Well, it seems like we're back in biochemistry again, but we're not. But then we are. Anyway, we're going to talk here about arachidonic acid, cell membrane phospholipids, basically the generation of arachidonic acid metabolites and their roles in inflammation. So we can just take a look at this to sit and stare and try to figure out what's going on. Immediately you might notice here up on the left, COX-1 and COX-2 inhibitors. Aspirin and indomethacin inhibit what? Cyclooxygenase. And the steroids inhibit phospholipases. So remember before we discussed the fatty acid breakdown and phospholipids. Well, here we can look at this figure, and we should recognize here that in the inflammation process we have one side that turns it on, the prostacyclins, and we have thromboxane, and then we also have which results in vasodilation, increased vascular permeability, and on the other side we have the turning off process where which inhibits neutrophil adhesion and chemotaxis. So this is involving lipoxin A and lipoxin B, so try to remember this. But we should be aware of this whole process, and if you can think back and remember, what does aspirin do, or how do the COX-1 and COX-2 inhibitors work? So to explain aspirin, how aspirin basically works and how they're different from the other agents, from other NSAIDs, we can say that it causes several different effects in the body, mainly the reduction of inflammation or analgesia, and the prevention of clotting and the reduction of fever. And much of this is believed to be due to decreased production of prostaglandins and TXA2. And this is because aspirin's ability suppresses the production of prostaglandins and thromboxanes due to its irreversible activation of the cyclooxygenase COX enzyme. And cyclooxygenase is required for prostaglandin and thromboxane synthesis. So remember that aspirin acts as an acetylating agent, where an acetyl group is covalently attached to a serine residue in the active site of the COX enzyme. See, we're back in biochem again. And this makes the aspirin different from other NSAIDs such as diclofenac and ibuprofen, which are reversible inhibitors. However, other effects of aspirin, such as uncoupling oxidative phosphorylation in the mitochondria and the modulation of signaling through NF-κB, are also being investigated according to Wikipedia. So there we have it. So basically look at this, recognize where we're going on this side. So how can we talk about arachidonic acid? It's talked a lot about in the media, but we should know that it is the primary fatty acid responsible for inflammation in muscle tissue. And we should know that arachidonic acid is necessary for the repair and growth of skeletal muscle. And in the brain, arachidonic acid is one of the most abundant fatty acids. Gosh, there's so much about arachidonic acid that we should know. So how can we summarize it and remember it? We should know that arachidonic acid, the pathway, constitutes one of the main mechanisms for the production of pain and inflammation, as well as controlling homeostatic function. So when you look at this figure, you should notice the different pathways and the different products that it can result in. For example, you can see that vasodilation inhibits platelet aggregation. This is a result of prostacyclin, but thromboxane results in vasoconstriction and promotes platelet aggregation. And so just look at both sides and see what the results are. And remember that the pathway produces different classes of end product. For example, the often discussed prostaglandins from cyclooxygenase metabolism, especially PGE2 and PGF2 F2 alpha and PGD2, the prostacyclins PG1, 2. So we should be able to recognize these and discuss them. Prostacyclin versus thromboxane, and also the leukotrienes on the other side. So what happens with the leukotrienes? And these, of course, are from lipooxygenase metabolism. So what is happening on this side? Well, first with the prostaglandins, they modulate the immune function via the lymphocyte, and they are mediators of the vascular phases of inflammation and are the potent vasodilators. They increase vascular permeability, and prostacyclin is a vasodilator and reduces platelet aggregation. But thromboxane is an important vasoconstrictor and increases platelet aggregation. But altogether, the leukotrienes catalyze the addition of molecular oxygen to specific double bonds in polyunsaturated fatty acids. I don't want to go too deeply into the biochemistry because I forgot most of it, but I'm going to try to remember this for the exam. I think I have to go back to the book.